We're diving into some really fascinating research today.
Yeah.
It's all about the connection between sleep and heart health.
Yeah, this is an area that's really starting to gain some traction.
For sure. So imagine you've got a patient with cardiac disease, and they're also telling you about all these sleep problems they're having.
Right. Happens all the time.
Exactly. So is it just a coincidence? Or could there be more to the story?
Well, that's what we're going to find out. That's what this whole deep dive's about.
And we've got two awesome articles to guide us. The first is a 2023 study from Science.
Oh, yeah. That one was a real eye-opener.
It dives into this potential new mechanism called denervation of the pineal gland.
Yeah, the pineal gland. You know, that tiny gland that controls our sleep-wake cycles?
Right, exactly. And then to get a bigger picture, we're also going to look at a 2024 review article from the International Journal of Cardiology, Cardiovascular Risk and Prevention.
Nice. So this one takes a broader approach, huh? Looking at the whole landscape of sleep disorders in patients with cardiovascular disease.
Exactly. A much-needed overview. And you know, that Science study really caught my attention.
Mine too. It's pretty amazing what they found.
So they actually discovered that in both mice and humans with heart disease, the pineal gland was losing its nerve connections.
I know, right? It's like the wiring was breaking down. They were actually able to visualize this denervation using some really cool techniques like 3D imaging of the pineal gland.
Wow, so they could actually see the nerve fibers and how they were being affected.
Yeah, it's pretty wild. But that begs the question, why is this happening? What's the link to heart disease?
That's what I was wondering, like, where does the heart come into play?
Okay, so here's where it gets interesting. They trace this denervation back to its source.
Okay.
The superior cervical ganglia, or SCG for short.
SCG. Got it.
Now, this is a cluster of nerve cells that basically acts as a relay station, sending signals from the nervous system to the pineal gland.
So I'm following you.
So what they found in the SCG of mice with heart problems was inflammation and scarring.
Inflammation and scarring.
Yeah.
Interesting.
Yeah, it's like the inflammation is causing a kind of short circuit in the wiring.
Oh, I see.
And that ultimately messes with the signals that control melatonin production.
Okay, so let me get this straight.
Yeah.
The heart problem is triggering inflammation, which then impacts the nervous system and eventually leads to sleep disruption.
Exactly. It's like a domino effect.
Wow. But is this just something that happens in mice?
Well, that's the million-dollar question, right? Does
Yeah.
this translate to our human patients?
Right, because at the end of the day, we want to know how this affects people.
Absolutely. And that's where it gets even more exciting because they actually used ultrasound imaging on human patients with heart failure.
No way.
Yeah, and they found the same thing.
You're kidding.
Enlargement and changes in the SCG, just like in the mice.
So this could actually be a new way to diagnose heart problems early on.
Potentially,
Yeah.
yeah. Think about it. We could be using ultrasound not just to look at the heart, but also to get a glimpse into the health of the nervous system.
Wow. That's incredible. And if we could spot these changes early enough, we might even be able to intervene before serious sleep problems develop.
Exactly. That's the hope.
But how did they figure out which nerve cells in the SCG were actually responsible for this pineal gland connection? I mean, there are a ton of nerve cells in there.
Right. So for that, they used some really advanced genetic analysis to look at the individual cells in the SCG.
Very cool.
And what they found was that the neurons specifically responsible for innervating the pineal gland were the ones being lost.
So it's not just general damage to the SCG, it's targeted destruction of the cells that control melatonin.
That's exactly it.
Wow, this is mind-blowing. So we've got this inflammation causing very specific damage leading to pineal gland denervation and reduced melatonin. Could this be the key to new treatments?
That's the big question. And to test it, they did something pretty clever in mice.
Okay, what did they do?
They injected a substance that basically eliminates macrophages, the inflammatory cells, directly into the SCG.
Interesting. And what happened?
Well, get this. It actually prevented pineal gland denervation and restored melatonin levels back to normal.
Wow. So if we could target this inflammation in the SCG, we might actually be able to prevent or even reverse sleep problems in our cardiac patients.
That's a real possibility.
Yeah.
And that could be a total game changer for how we manage these patients.
Absolutely. Now, I know this is still early research,
Yeah, for sure.
but the implications are huge. This could really change how we think about treating sleep problems in people with heart disease.
No doubt about it. It's pointing us towards treating the root cause of the problem rather than just managing the symptoms.
I'm already blown away. We've only scratched the surface here.
Mm-hmm.
So let's shift gears a bit and talk about the bigger picture of sleep disorders in heart disease.
Sounds good. Let's do it. Okay, so we've been talking about this link between heart disease inflammation and how it can actually disrupt melatonin production.
Right. And it's pretty fascinating stuff.
Totally. But now I think it's time to zoom out a little and look at the bigger picture of sleep disorders in cardiac patients. You know that review article we mentioned from the International Journal of Cardiology, Cardiovascular Risk and Prevention?
Yeah, what about it?
Well, it really paints a pretty clear picture of just how common these disorders are in our cardiac patients.
So give us the numbers. How common are we talking?
Well, for starters, over a third of patients with hypertension report poor sleep quality.
Wow, that's a lot. And is that all?
Oh, no, that's just the beginning. We see high rates of sleep apnea, insomnia, all sorts of sleep disturbances across a wide range of cardiac conditions.
So this is definitely not a niche issue. It's something that we should be considering with almost every cardiac patient we see.
Absolutely. And it's not just about feeling tired either.
Right, there's got to be more to it than that.
These sleep disorders can actually have a real impact on a patient's heart health and their overall outcomes.
Okay, so let's break down some of the specific disorders that were mentioned in that review article.
Pass you.
Let's start with obstructive sleep apnea, or OSA. We all know it's incredibly common.
Yep, one of the most common.
But how does it actually contribute to cardiovascular problems?
Okay, so with OSA, you have these repeated pauses in breathing while someone's sleeping.
Right, the snoring.
Exactly. And those pauses obviously disrupt their sleep. But the real danger is the drop in blood oxygen levels that happens during those pauses.
Ah, I see.
And that drop in oxygen puts stress on the cardiovascular system. It's linked to all sorts of problems like hypertension, arrhythmias, even heart failure.
So it's not just about the snoring. It's about the actual physiological stress these breathing pauses are putting on the heart.
Exactly. It's a serious issue. Now, what about insomnia?
Yeah, insomnia seems like everyone struggles with it at some point.
True, but when does it become a real concern for our cardiac patients? That's the question.
Good point. So what's the difference between just having a bad night and actually having insomnia?
Insomnia is more than just the occasional bad night. It's chronic difficulty either falling asleep, staying asleep, or waking up and not feeling refreshed.
Okay, so it's the consistency of it.
Exactly.
Okay.
And for someone who's already dealing with a heart condition, this kind of chronic sleep deprivation can have serious consequences.
Like what kind of consequences are we talking about?
Well, think about it. When you're sleep deprived, your body is basically in a constant state of stress.
Yeah, that makes sense.
Your stress hormones are elevated, your heart rate's up, and your blood pressure can increase. For someone with an existing heart condition, all of that can really worsen their symptoms and even increase their risk of complications.
So we really need to take those complaints of insomnia seriously, especially in patients who have heart failure or hypertension.
Definitely. Now, there's also another type of sleep apnea that we need to talk about.
Okay, which one is that?
Central sleep apnea, or CSA.
Okay, and how is that different from OSA? And why is it important for heart failure patients specifically?
Good questions. So central sleep apnea is a bit more complex than OSA.
Okay, how so?
Well, unlike OSA, which is caused by a physical blockage of the airway, CSA is a problem with the brain's signaling to the muscles that control breathing.
So it's a neurological issue.
Exactly. Basically, the brain just forgets to tell the body to breathe.
Oh, wow. That sounds scary.
Yeah, it can be very serious, especially for patients with heart failure.
Why is that?
Well, CSA is actually more common in heart failure patients, and it's linked to a worse prognosis. The disrupted breathing patterns just put extra strain on an already weakened heart.
That makes sense. So we've got OSA, insomnia, and CSA, all prevalent in our cardiac patients and all potentially contributing to worse outcomes.
Right, and I think what really drives this point home are specific examples of how these sleep problems can actually lead to real clinical consequences. You know, like those aha moments.
Yeah, totally. Those are always helpful.
So there was this one study that found that treating OSA with CPAP therapy actually reduced the levels of troponin I and brain natriuretic peptide in patients with hypertension.
Now, I know you mentioned these biomarkers earlier, but for those of us who don't work with them every day, why is that clinically significant?
So these biomarkers are basically indicators of cardiac stress and damage.
Okay.
The fact that CPAP therapy, which improves breathing during sleep, was able to lower their levels suggests that treating OSA could have a direct benefit on heart health.
So if not just improving their sleep, we might actually be protecting their heart from further damage.
Exactly. Now, there was another really interesting finding about sleep disturbances after a heart attack.
Oh, tell me about that.
So this study found that women who had sleep disturbances after a heart attack actually had a higher risk of long-term cardiac events.
Wow, that's significant. And what about the men?
Well, for the men, it was actually impaired awakening that seemed to be linked to a higher short-term case fatality.
So it seems like this specific type of sleep problem could have different implications depending on whether the patient is male or female.
Right. And that just highlights the need for a really personalized approach to diagnosis and treatment.
For sure. We can't just assume that all sleep problems are the same. We need to ask the right questions, really listen to our patients, and tailor our management accordingly.
Exactly. Now that we've established that sleep disorders are common, serious, and require our attention,
Right.
I think it's time to talk about what we can actually do about it.
Yeah, let's shift gears and talk about some treatment strategies. All right, so we know that sleep disorders can be a real problem for our cardiac patients.
Yeah, they're definitely something we need to be paying attention to.
For sure. But what can we actually do about it? Where do we even begin with treatment?
Well, the good news is that we actually have a lot of options.
That's good to hear.
Yeah, ranging from simple lifestyle changes to more targeted therapies.
Okay, so walk me through it. What are some of the first steps we should be taking?
Well, first and foremost, we need to remember that sleep is a crucial part of cardiovascular care.
Right, it's not just something we can ignore or push to the side.
Exactly. It's not just an afterthought. It needs to be a core part of our management plan.
I agree. So are we talking about things like sleep hygiene?
Sleep hygiene is a great place to start. We should be talking to our patients about things like creating a regular sleep schedule, having a relaxing bedtime routine, and optimizing their sleep environment.
Yeah, those are all really important things. But sometimes those basic changes aren't enough.
Right. Sometimes patients need more intensive intervention.
So what are our options in those cases? What are some of the more evidence-based treatments for specific sleep disorders?
Well, let's start with OSA, since it's so common.
Okay.
CPAP therapy is still considered the gold standard for OSA. It's been proven to be really effective in reducing those dangerous pauses in breathing and improving overall sleep quality.
I know CPAP can be a tough sell for some patients.
Yeah, I hear you. It can be hard to adjust to.
I've had patients tell me it feels claustrophobic or that they can't stand the noise of the machine.
I've heard the same things. So patient education is really key here. We need to explain why CPAP is so important, address their concern, and be willing to troubleshoot any problems they might have.
Makes sense. Are there any alternative treatments for OSA if a patient really can't tolerate CPAP?
There are some oral appliances that can help reposition the jaw and tongue to keep the airway open.
Okay, and what about for patients who are overweight or obese?
Weight loss can be a game changer for those patients. Oftentimes, even losing a small amount of weight can significantly improve their OSA symptoms.
So it's really about individualizing the treatment plan for each patient.
Absolutely. Now, what about insomnia?
Yeah, we were talking earlier about how damaging chronic sleep deprivation can be for cardiac patients.
Right, it can really take a toll on their health.
So how do we go about treating insomnia?
Cognitive behavioral therapy for insomnia, or CBTI, has become a really valuable tool.
CBTI.
Yeah, it's particularly helpful for patients with heart failure.
Interesting. What does it involve?
Well, it basically helps patients identify and modify the thoughts and behaviors that are contributing to their sleep problems.
So it's not just about taking a sleeping pill.
Yeah.
It's about getting to the root of the problem.
Exactly. And CBTI has actually been shown to improve sleep quality and reduce insomnia severity in heart failure patients.
And I imagine that would then have a positive impact on their heart health as well.
Exactly. It's all connected.
Now, before we wrap up, I have to ask you about that research from Science.
Which one?
The one about targeting inflammation in the SEG to potentially prevent or even reverse the denervation of the pineal gland.
Oh, yes. That was a really fascinating study.
Is that something that could realistically become a treatment option someday?
It's definitely an exciting area for future research. Imagine being able to directly target the root cause of sleep problems in our cardiac patients. It's still early days, but I think this study opens up a world of possibilities.
It definitely seems like we're on the cusp of a major shift in how we think about and approach sleep when it comes to heart health.
I agree.
So to sum it all up for our listeners, what are the key takeaways you want them to remember from this deep dive?
Okay, so I think the three most important points are,
Okay.
first, sleep is not just a luxury, it's an essential part of maintaining good cardiovascular health.
Could not agree more.
What's number two?
14.
Second, sleep disorders are not uncommon in patients with heart disease, and they can have a really big impact on their overall outcomes.
Absolutely. And last but not least,
And finally, be proactive. Screen your patients for sleep disorders, take their complaints seriously, and work with them to create a treatment plan that's tailored to their individual needs.
excellent advice. A good night's sleep really can be the best medicine.
That's the truth.
And for our listeners who are interested in learning more about this topic, you can find the full citations for all the articles we discussed in the show notes.
We encourage you to check them out.
And as always, we would love to hear your thoughts on this episode. What are you doing in your practice to address sleep disorders in your cardiac patients? Let us know.
We'll be checking the comments.
Disclaimer and bibliography in the description.